Hello everyone, greetings of the day. My name is Karthik Akinapelli and I'm hoping you're all doing well. Today, I'm excited to share the results of a trial conducted to evaluate a new oral antibiotic in comparison to empiric ciprofloxacin. So why late? Let's dive into the study and look at its key findings. So before we jump into the trial information, let me give you a little bit background of this trial. So why new antibiotic? There is a growing concern about increasing fluoroquinolone resistance in real-world settings, which significantly limits treatment options for uncomplicated urinary tract infections in outpatient setting, which leads to hospitalization. Now, why is sulopenem? Sulopenem is the first oral thiopenem antibiotic specifically developed to combat multi-drug resistant gram-negative uropathogens. Uropathogens are nothing but pathogens responsible for urinary tract infections. Now about this study. This is a phase 3 double-blind study evaluating the efficacy and safety of a 5-day course of sulopenem compared to the standard 3-day regimen of ciprofloxacin in adult women with UTIs. Coming to the endpoint, the primary endpoint is a robust composite measure assessing both clinical symptom resolution and microbiological eradication at the test of cure visit, which is day 12 in the study. Now let's look at enrollment overview. A total of 1672 women were enrolled in the trial, of which 1660 participants were qualified for the safety population, meaning they received at least one dose of study drug, whereas 1072 participants qualified into microbiologically intent to treat population. This is where the primary endpoint is evaluated. The criteria to qualify into this population is that the baseline pathogen should have at least 10 to the 5 CFU per ml. CFU is nothing but colony forming units. Now, key findings. E. coli was the predominant pathogen, accounting for approximately 85% of all infections in the study. Of these, 27% demonstrated non-susceptibility to ciprofloxacin. That is pretty high rate. Now, second most common pathogen identified was Klebsiella pneumonia. Now, looking at resistance insights, around 13.5% of the total isolates were extended spectrum beta-lactamase producing ESBL producing organisms, indicating multi-drug resistance. Now, let's look at efficacy results. In non-susceptible pathogens, sulopenem demonstrated clear superiority over ciprofloxacin in treating non-susceptible pathogens, with a significant treatment difference in efficacy of 26.6% and a highly significant p-value. Now, in susceptible pathogens, sulopenem did not achieve non-inferiority. The response rate for sulopenem was 66.8% in sulo compared to 78.6% in cipro. Now, in overall study population, combining both non-susceptible and susceptible populations, sulopenem achieved non-inferiority with a response rate of 65.6 in sulo compared to 67.9 in ciprofloxacin. So, let's look at clinical response. The study evaluated clinical response at various time points with the following key findings. At initial evaluation at day 5 of the study, sulopenem and ciprofloxacin demonstrated comparable response rates, 68.7% sulo versus 67.3% in cipro. At day 12, which is at primary endpoint, sulopenem showed similar overall effectiveness in clinical response compared to ciprofloxacin, 81.1% in sulo versus 84.1% in cipro. Whereas in the resistant population, sulopenem clearly exhibited superior efficacy, 83% in sulo versus 62.6% in cipro. Now, they also evaluated at follow-up period, which is day 28. Both treatment groups maintained a sustained clinical response, confirming the durability of the treatments. Now, with Good clinical response. Why did sulopenem did not achieve non-inferiority in non-susceptible pathogens? This is because of ASP impact. Like I said, while clinical response rates were comparable between two treatment groups, the difference lay in microbiological outcomes, specifically the occurrence of ASB, asymptomatic bacteriuria, which is nothing but patients are clinically cleared but has a positive culture. Now, at day 12, ASB was more prevalent in sulopenem group compared to ciprofloxacin, 15.2% in Sulo versus 7.8% in Cipro. Despite the higher ASB rates, patients in both groups demonstrated equivalent clinical outcomes during follow-up period at day 28, as we saw in the previous slide. This is confirming the durability of the treatment. So what's the conclusion? The higher ASB rates with sulopenem likely reflect the restoration of normal urobacterial flora rather than persistent infection, highlighting a potential microbe advantage. Now, let's look at resistance emergence. So some of the key observations include resistance development. Following treatment with ciprofloxacin, 41.7% of initially susceptible pathogens developed resistance, very high percent, indicating significant selective pressure. Now, genetic changes in pathogens. Post-treatment, some pathogens acquired extended spectrum beta-lactamase, ESBL genes, compromising multiple antibiotic classes and further limiting treatment options. Now, looking at sulopenem MIC stability, in contrast, MIC distribution for sulopenem remains stable, demonstrating a low risk of resistance development. So what's the conclusion? The contrasting effects on bacterial resistance patterns underscored the critical importance of antibiotic stewardship and informed drug selection in managing UTIs. These findings highlight sulopenem's potential as a valuable option in combating antibiotic resistance. Now, let's look at safety profile. So both treatment groups showed almost similar safety results. Sulopenem showed 25% of adverse event rate compared to ciprofloxacin at 14%. And the most common adverse event include headache, which is 4.2% in Sulo versus 3.1% in Cipro. And the next most common adverse event found is nausea, 3.8% in Sulo versus 2.2% in Cipro. Diarrhea, which is GI related, was significantly more common with sulopenem at 12.4% versus 2.5% in Cipro, with a mean duration of 3 days. But 95% of cases resolved spontaneously, while 5% required antidiarrheal medication. Other GI effects include nausea and abdominal pain, pretty much very common with all antibiotic classes. Serious adverse event rates are also similar, 0.7% in Solo versus 0.2% in Cipro. And of the 6 serious adverse events on sulopenem, only 2 were considered drug-related. And in the course of the study, no deaths occurred, and all the SOEs are resolved by the end of the study. Now, implications of empirical treatment. Similar overall efficacy. So, sulopenem showed non-inferiority to ciprofloxacin in general population, as we seen in the previous slides. Resistant advantage. Sulopenem showed superiority to ciprofloxacin in non-susceptible population. Reduced risk resistance. As discussed in the previous slide, sulopenem demonstrated low risk of resistance development and giving a treatment option for multi-drug resistant UTIs. Sulopenem showed effectiveness against pathogens that are resistant to multiple antibiotics. Now let's look at some study limitations and considerations. Limitations include the study was conducted before the implementation of updated treatment guidelines, which may affect its relevance to current clinical practices. The inclusion of ASB in the primary endpoint may not fully align with real-world clinical practice patterns. Now, short-term follow-up limits the ability to assess the long-term emergence of resistance. Coming to the key considerations, Results indicate that empiric use of ciprofloxacin should be avoided in settings where resistance rates exceed 10%. Now, balancing the therapeutic efficacy with the potential for mild gastrointestinal side effects is essential. Sulopenem offers a viable treatment option for multiple drug-resistant urinary tract infections, addressing a critical gap in current treatment options. Now, finally, conclusions and further future directions. Sulopenem has demonstrated significant efficacy in treating multi-drug resistant urinary tract infections, providing a crucial alternative to existing empirical treatment options. Incorporating regional antibiotic resistance data into clinical decision making is essential to optimize therapeutic outcomes. The study highlights sulopenem's potential to minimize bacterial resistance development while maintaining its therapeutic efficacy. There is a critical need to further investigate long-term resistance patterns and patient outcomes through comprehensive longitudinal studies. Finally, continued exploration of sulopenem's implementation in diverse clinical settings will help refine its role in managing multi-drug resistant infections. Thank you so much for giving me this opportunity and take care. Bye.